Kia ora, my name is Maria and my presentation is on shoulder dislocation. And according to the Merck Manual 2021, shoulder dislocation is when in the shoulder femoral dislocation. This is when the humeral head is separated from the femoral fossa. So the shoulder is pretty much out of its socket. As to speak in layman terms, it's the board out of its socket. Etiology and epidemiology. In etiology, we have direct impact, like cerebrals, either in sports, contact sports, like rugby league, tackling, lots of falls. In non-contact sports, you also dislocate shoulder, in volleyball, netball, basketball, or gymnastics. And non-sports activities can either have a motor vehicle accident or motorbike accident. You can also have seizures or electric shocks that can cause muscle contractions that can cause the arm out of its place, as to speak. Epidemiology usually occurs with males less than 20-year-old who's very active either in sports or physical activity. And females it's normally with the older populations due to postmenopause, could be osteoporosis, especially with females, and that could cause high risk of falls, falling down, and also with patients with existing shoulder injuries, labrum tears, rotator cuff tears, and fractures either in the clavicle, humeral head, or the glenoid humeral joint. Prognosis, unstable injury. Shoulder dislocation is definitely an unstable injury. So unstable injury means it's where the shoulder area is having to compromise its surrounding structures that have been damaged and then unable to provide necessary support to the shoulder joint. The dislocation is an injury to a joint where the place where two or more bones comes together, the ends of the bones are forced out of the normal position. This painful injury temporarily deforms and immobilizes your joint. Clinical manifestation. Deformity, visually you'll be able to see a deformed shoulder joint, out of place shoulder compared to the normal shoulder. You'll be able to see swelling, bruising, and then the patient will be in intense pain because it's an acute injury. So the neurological symptoms, either with single nerve injuries as well as more complex brachial plexus injuries that can cause a wide scale of disability, ranging from transient weakening of the upper limb and feelings of tingling sensations going through the upper limb. This can lead to a permanent paralysis of the limb. The prognosis for shoulder dislocation is an acute injuries will seek urgent medical attention. So the specialist of the GP, A&E clinic, will try and do a close reduction. They may be able to do a gently manoeuvre to help the shoulder bones back into its proper position. Depends on the severity of pain and swelling. Surgery if the shoulder joint or ligaments are weak may require surgery, and also tends to have recurring shoulder dislocations despite proper strengthening and rehab. Also surgery if the nerves or the blood vessels are damaged as well. Immobilization is specialists or GP use a special splint or sling for a few days, up to 3 weeks, just to keep the shoulder stop it from moving. Medication is also prescription painkillers, relievers, or muscle relaxants for pain reduction, for example, Voltaren or cortisoids and steroids to reduce pain and inflammation. Rehabilitation after shoulder sling is removed. Gradual rehab program to restore range of motion and also strength and stability for the shoulder joint. The body's response to shoulder dislocations, we have the immune system injury, initiating the inflammation process and getting rid of any foreign debris. We have the white blood cells that act like security guards. They guard and they protect and also attack any foreign debris that's trying to get into the immune system. And there are two types as well. We have the red blood cells that contains oxygen and hemoglobin protein. Its function is to oxygenate the body and remove any carbon dioxide. That's through expiration from the lungs. Also have blood platelets. They also help to clog up and prevent further bleeding, and that's made in bone marrow to promote blood clotting. That's also acts as a temporary band-aid. Muscle and tendons, they're overstretched, and can be strained. So it also can result in pain in the local area of injury. And the nerves in the shoulders region can be compressed by muscle, tendons, or bones, and that results in tingling sensation feeling throughout the upper limbs in the shoulder area. It also can cause some numbness, unable to feel twitchy through fingers. It is called paralysia. So inflammation and the healing process. Inflammation, we have the cardinal signs, the four cardinal signs: redness, heat, swelling, and pain. And they start when the injury is in an acute stage. So the healing process in short term can be obviously call an ambulance, seek urgent medical attention, and in the meantime you can use price, which is people protect, for rest, eye for ice, self compression, and E for elevation. In the long term, also still use price method. You can use scans or imaging for healing, for the healing stage and recovery plan for the next few weeks and months. And you'll start seeing a physiotherapist and also a massage therapist. So the benefits of massage therapy in regards to shoulder dislocation. It is okay to work in the subacute stage as a massage therapist. We do have to do a full pre-screening with them. If they're very likely to be referred from a physiotherapist. We also need to be wary of the medication, which medication they're on, how long they've been on, and also making sure that the pain tolerance could be altered because of the medication side effects. So we really need to be wary. For example, if their pain scales like, say, 4 out of 10, it could be likely to be very high, maybe a 7 or 8 out of 10. So yeah, that's very important. Also, still go through your posture analysis assessments, range of motion. So you'll be doing active, passive, and resisted range of motion as well. Also do your street test, relief test, and orthopedic tests as well. But making sure that you regularly use pressure scale with them, especially if it's a fully dislocated shoulder. Just avoid any traction or mobilization techniques in the shoulder region because it's dislocated. We want to prevent further injury to the shoulder joint. So the question was, is massage therapy beneficial for shoulder dislocations? I would have to say yes, according to research and paper, there is some beneficial benefits. The effects on massage therapy is a great benefit compared to having no sort of soft tissue massage therapy. Inactive, and also regards to immediate effects of shoulder pain. So close examination revealed that sports massage with a hot pack applied to the neck shoulders and back for 36 sessions. That actually had the greatest effect size according to this research. So yeah, that's my presentation, and the next slide is my references. And these are my references for my presentation, and thank you for listening to my presentation. Okay, Jane.